Okay.
Pardon me. Thank you, Joy. It's a delight to be here, albeit virtually, with the Vermont librarians. As Joy mentioned, my home base is in rural upstate New York, even though I do teach at UNC Chapel Hill. I had been living in Chapel Hill during the academic year until the COVID changed everybody's lives. So just a little background for me. I started out as a reference librarian at Johns Hopkins School of Public Health and went from there to head up a health research center in Atlanta. And then, you know, as life takes you on turns and twists, I ended up running a small rural library here in upstate New York. I was a public library director for 6 years before I went back to school to get my doctorate and then ended up teaching at UNC. So I've kind of, pardon me. Excuse me. I've been looking at health information from a lot of angles over the course of my career. And once I landed in the public library, especially in a rural community, I realized just what opportunity we have in terms of supporting our communities around health. So having said that, I'll kind of dive in. As Joyce said, we'll have time for questions and discussion at the end. I have just 20 or 25 slides. I'm going to talk about just a little background, some ideas for health information tools, ideas for collaborating in your community. I'll give some examples of initiatives that are going on, and I'd be happy to hear about things you all are doing out there as well. I'll talk a little bit about some of my research and how that's been applied. A little bit about what are our next steps, and then we can spend time just chatting at the end of the session. So more than ever before, I think, at least in my experience, the public health community is recognizing public libraries as partners, as collaborators, as places where health is being promoted, health promotion activities are taking place. This is a photo from the Nation's Health, which is a newsletter from the American Public Health Association, and it's the Boston Public Library and folks doing yoga there. And it was interesting to me to talk with some of my friends in the public health world who were just like gobsmacked that these things were happening at public libraries. And I thought, well, we've been doing this for a long time. We just haven't been making it known to the greater community. And in fact, in 2000, oh, sorry, Okay, in 2015, Americans visited their libraries 1.3 billion times, but healthcare professionals 990.8 million times. We have more visits to libraries than we do to healthcare professionals in this country. And I imagine pre-COVID and all our busy libraries, you all could attest to that in your communities. From that same Nation's Health newsletter, this is a quote. And when they advocate that when it comes to finding the best health information available, or even getting a blood pressure check or finding a cool place to go, folks visit their public libraries, their local libraries. They don't go to their doctor or their health department. So again, I see this as an enormous opportunity for us to be supporting our community's health. Close to 40% of people who go to libraries did so to seek out health information. And in fact, we have more public libraries than McDonald's in the US. So what that means here in my rural upstate community is that we have 3 counties that don't have any hospital, but every one of our counties has at least 4 public libraries. So in terms of reach, in terms of health information outlets, we do have social capital and clout for trusted organizations. Nationwide, we've seen program attendance increase more than 30% in the past 15 years in public libraries. And the majority of libraries are offering some kind of health programming, whether that's on how to evaluate health information, whether it's panels by providers and specialists. Folks are doing health screening, having vaccine clinics, fitness classes, embedded staff like social workers or public health nurses or consumer health librarians. But it's a bit uneven in the distribution. We're seeing this more in suburban libraries than in rural libraries. Less than half of rural libraries report this kind of programming. But over half of our public libraries serve populations less than 10,000, and so indeed they are classified as rural. So I see this as an enormous opportunity. Please excuse me if I keep saying that, but I do. It's where I live and breathe. So just to talk a little bit about rural residents and why it's important for libraries to be involved, nearly 1 in 5 of Americans live in a rural area, and those folks that live in rural areas are more likely to have a number of health challenges. They're more likely to be obese, to be uninsured, to have lower incomes, to have a chronic illness, and also to be older. And we know that with age often comes health-related challenges. In 10% of our rural counties throughout the country, there's no primary care physician. And I want to point out as well, we have our digital divide. And now, especially with telehealth and virtual health, and its layer of challenge for folks to even communicate with their providers now. And libraries can help with internet access. So Joy posed this to me when we were talking, excuse me, about my joining you all today. If a small library can only have a small collection of books on consumer health, what would you recommend? And I thought about this a lot. I've thought about this a lot over the course of my career, because when I started out at the Hopkins, there was something called the Brandon Hill List. And it was compiled by the Medical Library Association. And it was a list of what were your core resources for a medical library. And then it was based on population served. So if you served this many, what should you have in your collection? If you serve this many, a little bit more, that kind of thing. And the Brandon Hill list has gone by the wayside, especially with the internet now. And health books are expensive. They go out of date quickly. And it's hard to keep up with what's new. Health changes all the time, what we know about health changes. So one of the things I found in my research, I'll talk about a little bit later, was when folks turned to online resources rather than the print collections in the libraries, they were more likely to find authoritative information. So I wanted to start with online resources because I think that in terms of cost, these are free, unless you factor in what it costs to run your computers at the library and all of that, but you're not paying database access for any of these online resources. The top being Medline Plus, and that still is my go-to, and that will take you out to Mayo Clinic. It will take you out to American Cancer Society. It's updated regularly. It's vetted by librarians and information specialists. So in terms of consumer health information, just having a link to this on your website for your patrons is a great start in terms of knowing they are going to a resource that's been vetted. Mayo Clinic is another favorite of mine, and very often Medline Plus will steer you to Mayo Clinic. In these times of COVID and COVID tracking, the New York Times and Johns Hopkins University are the places to go. I'm dismayed to say that our CDC has become somewhat politicized. I'm not going to go down that road today, but they would be my go-to for that kind of information historically. But when I looked at their website in May, it had last been updated at the end of March in terms of COVID numbers. And, New York Times and Hopkins were updating every 8 hours. So CDC still is a premier source for what's the range of Lyme disease? What is Lyme disease? What are the treatments for Lyme disease? But in terms of up-to-date tracking of COVID, I would use the other sources I mentioned. I also want to give a shout out to the Medical Library Association. MLAnet.org is their website. And They have a spot on the website that says for patients, and also how to find good health information. They give a lot of tools and a lot of guidance. There's top health websites on there as well. So those are all places to look for your online. I do know that print is important in terms, at least in my experience, and I know that folks are still checking out books. And so for the print collection, I would say try and tailor the collection to your community. So if there are prevalent conditions or health risks that are known in your community, you can use these resources, such as the one I'm using. I'm hoping the screen's working. This is from Robert Wood Johnson Foundation, where it's county health data. And you can see, if you just click on a county, you can learn what percentage of people have poor health, what are the health behaviors. It looks like a third of folks have obesity, 15% of adults smoke. So you can use this to tailor programs, to tailor resources. Census.gov also is better than it's ever been in terms of discrete data and finding out about your community. So I would suggest looking at your community and seeing if you have a high rate of diabetes. Maybe then you consider getting things from Jocelyn Diabetes and publishers like that. Another thing that I would impress is, and I impress this upon the students in my collection development class, your collection is about your community. It really isn't you saying this is what they need. It's them saying this is what we need. And so build upon what you have and pay attention to patrons' interests. Cookbooks are part of your health information collection, or can be. Hiking guides can be. If you have a very active community, do you have trail guides? Do you have outdoor activities, resources that you can steer them to? I think this can also be a place where you leverage library services to try and reach populations that you're not. Are there possible hooks? Are there programs or resources that you could be providing to folks to bring them into the library, or to bring them onto the library website, to have them interact with the library in a positive way? In terms of health promotion, there really are a lot of opportunities. You can have volunteers teach fitness classes. There's yoga instructors across the country working in public libraries. Panels of experts are also an easy kind of low-hanging fruit to offer in your community. Storytime programs. I heard Mariah, when we were signing in, talking about her virtual story time. Using books with active themes and having the kids dance and march and stretch is another kind of easy, low-hanging fruit. Taylor summer reading prizes on physical activity. Give out pedometers or Fitbits as the prizes. In one library, we installed an electricity generating exercise bike. So the longer the kids pedal, the harder they pedal, the more lights light up. I thought about attaching a fan or a refrigerator to it, but the library director convinced me we don't want the kids expiring in the library. So there's lots of organizations that you can depend upon, that you can work with, that you can tap on to do this. You're not in this alone. As I said earlier, public libraries have a lot of social capital. They're really embedded in communities. So your friends at the public health department and in the healthcare organizations will help with those panel of experts. They'll help with signage for COVID outbreak and what you should say in terms of people being required to wear masks. All of your educational organizations, cooperative extension agencies are, in my experience, always willing to come and give talks about healthy nutrition or how to keep yourself from getting ticks when you're hiking, things like that. Your social services organizations are another place that you can tap. And also you can provide resources such as a training, a community room where they can provide training for CPR. Faith-based organizations, service organizations, businesses, they are all candidates to be working with. When I was at the Sydney Library, I did a regular kind of route of the Rotary and the Kiwanis and the Lions Club, and did presentations on how to use Medline Plus, how to use these resources to find authoritative health information. So I just want to give an examples of a few things going on. And as I said, I'll be happy to hear about things you all are doing in your communities. Of course, these are pre-COVID. And I thought about updating for post-COVID. I will talk a little bit about what I've heard folks are doing. But my hope is that a year from now, we're talking about COVID in the past, and we're all vaccinated. So I'm moving forward as if we will be back to a new normal within the next couple years anyway. So some of the things, you know, smart snacking in San Jose, free flu vaccines in LA, sexually transmitted infection testing. It's been found that they reached a younger, asymptomatic, and predominantly Black population more readily in the public library than in the traditional health department clinic site. So there are some advantages in the library. We've heard about libraries administering Narcan or naloxone, and in Hawaii, they have needle exchange programs. This is really going down a path of public health, at least from my perspective, that public libraries have never been going down before. And I think we need to be talking about that. What are our expectations of public library staff, and having to change roles? And is it the role of the public library to be dealing with these very gnarly social issues? The University of Pennsylvania and the Free Library of Philadelphia have a number of healthy library initiatives going on. And I'll share these slides with Joy at the end, so you'll have these links in case you want to investigate any further. So I wanted to kind of sum up a bit with some of my experiences around health information. When I was the director at the Sydney Memorial Public Library, in a town chartered to serve 8,000, we applied for a grant from the National Library of Medicine. And the grant was essentially to train healthcare providers to use Pubmed. This was back in 2004. It was early days of internet access to Pubmed, relatively speaking. And we found that it was much more effective for us to train library staff than the healthcare providers. Without going into a lot of detail, the healthcare providers were not as willing to be trained as the public library staff. And we realized that we were reaching more people by training the public library staff. And a year after the training, they were 19 times more likely to use NLM to answer consumer health queries than prior to the training. For my dissertation research, I investigated libraries in New York and Delaware, and then post that in North Carolina. And I visited libraries all over all those states and looked at the materials on the public library shelves. And, you know, I would have been guilty of this as well at the Sydney Library. There were health books that were really outdated. And even on the reference shelves, there were books from 1979, you know, Better Homes and Garden reference guide. And I don't think that's happening as much as it had when I was doing that work in 2008, 2010. But I think that some medical librarians recommend weeding your medical collection and not having anything that's older than 2 years. Some say 5 years. Those are really hard to do in a public library in terms of budget and what you spend. But having something 10 years old, if it's about Lyme disease where the protocol's changed, or then we need to be updating and we need to be using those online resources. I think too, folks might go directly to the print collection, and what's on the shelf they think is what you are offering as the best thing because they trust their public library. So I would say keep up to date in your health information section. And from my perspective, with outdated health information, no book is better than an old book that was written before AIDS was coined a term. In Delaware, we found the embedded librarians had a positive effect. Delaware had a program where they put consumer health librarians in the 3 main counties in the state. And we found that even in the regional libraries, in Delaware in general, the librarians were 70% likely to go to an online resource rather than the print collection, whereas the opposite happened in New York State. And in New York, we were very often given information that was not evidence-based or in keeping with what our current medical knowledge knows. When I got to UNC, I started some projects. One was having public libraries in our 3 different regions lend out pedometers. We wanted to see what was the willingness of folks to be involved in this. And we got very positive feedback on that. And one of the libraries in rural eastern North Carolina, Farmville, and that is the real name of the library, followed on by we introduced to them CHART, which is the Carolina Health Assessment Research Tool. So they had that available for patrons, where patrons could do a health assessment, see where they could change behaviors. And it ended up 6 months and a year on. Some of the patrons had lost weight, had increased their exercise. So that was a useful resource for the library. The library director has signed on so willingly that the town created a new position, and they call him the town wellness coordinator. When he decided to stop serving sweet tea at the board meetings, at the town board meetings, they decided maybe he'd gone too far. So they offer water and sweet tea now. So you have to go at these things lightly. We also created a resource called Read and Reach. And my grad assistant updated it a few years ago, but we haven't kept it as up to date as we'd like to. It's that thing of too many balls in the air. But the Read and Reach is just a website of books that promote active story time. So books that might get kids moving and dancing. And we did present this at the PLA conference, and I presented this with one of your colleagues, Star Latronica. And she read the book, and we acted out the 5 little monkeys jumping on the bed. And I only share this because when we all, 200 librarians on a Saturday morning at the conference, followed Star's instructions and yelled, "Doctor, doctor," according to the story, all the security guards came running in because they thought someone was hurt. So anyway, just a little anecdote about one of your Vermont friends. These are just some of the scenes from Farmville. They now have monthly bike workshops, and now they're doing these with social distancing or they had been, I think they've probably suspended them now, but in their parking lot. But they have bike workshops that the police come and give away helmets. They have local folks teach you how to fix your bikes. And then they also started an annual fun run. They have a lot of things going on around health promotion activities. So I think if our mission of libraries is access to information and opportunities and resources, health promotion fits in well with that. So in terms of our next steps, the things that I think about are, how do we extend these efforts? How do we lend support to extend these efforts? How do we measure the reach of our efforts? We've been good at counting how many people check books out, but how do we track that our active story time led to that child becoming the track star they were? Or, I mean, those are much harder things to measure. And how do we evaluate that impact? Do we find that we have healthier communities when our libraries support health promotion? Also, how do we make these efforts work during a global pandemic? So before I go, I wanted to just offer this to you. I heard just this week from my friend Jamie at the American Library Association, and this is the email she sent, which was asking for help. They're looking for ways libraries have innovated and moved to virtual services during the pandemic. And they'd love to have a short 1,200 to 1,500 word chapter that shares the story of how a public library shifted any health services online during the pandemic. And I said to Jamie, I don't have I'm no longer running a library. I don't have a direct experience with that, but I would share that with the folks in Vermont to see if anyone was interested in this. And if you are, Jamie has asked that you just write to her directly, and that is her email there, and I will supply that to Joy as well, jsantoro@ala.org. So I think at this point, we'll break for questions. And I do, at the end of this, have some references as well and resources in case you need them. So I'm going to escape and let me see. Joy, are you there?
Yes, I'm here.
And I think I stopped sharing now.
You did. Now I'm just seeing people who are signed in. Mary Grace, that was so excellent. I've been taking notes, and it'll be great to share these slides and references, resources with people that aren't here. And so did I understand correctly, I could share the ALA message from Jamie widely and throughout Vermont to see if there's any, okay.
Absolutely. That would be wonderful. Thank you.
Yeah. I'm not sure, if the degree to which people have, a lot of things have switched virtually. I'm not sure how much health things have, because there's tends to be a lot of outdoor things, and that's sort of the Vermont way, but it'll be interesting to see if there's some interest in that. So since it's a small group, I think that if people want to just ask questions, let's just try doing it verbally if you want, or you can do it in the chat and I will monitor that. I have one question first, just to clarify something that I'm confused about. Pubmed versus Medline. What's the connection there between those two?
Sure, that's a great question, Joy, and it's interesting. The medical library folks, I think, don't understand just how the acronyms just kind of don't work that well. Like, one of my complaints about Medline Plus is it's very clunky in terms of a name compared to WebMD, right? So Pubmed is the bigger kind of system of the National Library of Medicine. Pubmed is the way you get into the National Library of Medicine's whole kind of databases and literature. So Pubmed is a bigger piece of it. Medline historically was the medical literature itself. So that was all the citations of all of the medical journals, medical articles. So Medline started in the 1960s, and it was the indexing of all the medical literature. When the internet hit and Medline became available, and Pubmed is the bigger thing that Medline is available through, it became apparent that the folks that were using Medline were not the practitioners, were not the researchers. There were a lot of consumers using Pubmed. And at that point, it was just, or Medline, it was just the biomedical literature. So the folks at NLM realized they needed to have a consumer health arm of Medline that was tailored for regular consumers, not physicians, not researchers. So with much simpler language, with attention to easy reading levels, there's even buttons that you can push to make the screen larger for folks that might have visual impairment. It's in a lot of different languages now, Medline Plus. So Medline Plus became the consumer health arm of the NLM's products. Does that make sense?
Yes, that's what I thought, kind of, but I wasn't actually sure. So I'm glad to have that clarified.
Yeah, no, it's very confusing. And I think part of the issue and problem is that the folks that are, come up in it, I started, 40 years ago, I suppose, in a medical library, and it just becomes part of second nature. And we all went through that in terms of Medline, then Medline Plus, then this and that. And we forget that none of it really is accessible in terms of terminology, I think.
So like public library director would mostly be using themselves and sharing with their patrons Medline, not necessarily Pubmed. Is that correct?
That's Medline Plus. So
Medline Plus, yeah.
Medline Plus.
Okay.
Yep.
Okay.
Yep. So medlineplus.gov will get you to the consumer health arm of the National Library of Medicine.
Okay.
Pubmed is like the bigger that will also take you to Medline, regular Medline, which is just the biomedical literature, but it also will take you to toxicology resources. And so if you go to pubmed.gov and noodle around, Medline Plus is in there, but the easier, more direct route is just medlineplus.gov.
Okay. Are there other people who have questions?
I do. I have a question. This is Mariah Lawrence from the Tunbridge Library. You guys can hear me, right?
Yes.
Yes.
Okay. I was just wanting to hear a little bit more about the pedometer project and like what type of assessment tools he used. I feel like what you're saying is so important. I mean, in my community and probably in everyone's community, this isn't like an avenue I've gone down, but it's definitely, I would love to know more about how he became the town wellness coordinator.
Sure. I'm happy to talk about David Miller. He's one of my champions. And that was just one of those serendipitous kind of encounters. David, he attended a meeting. It was a North Carolina Public Library Director Association meeting, my very first semester I was there. And I presented at that. And at the end, I said, if anyone's interested in health promotion, I'd be happy to talk about it. You know, for instance, maybe we could be lending pedometers at libraries. And it was one of those things that just popped out. And at the end, he came up and said, what did you mean about lending pedometers? And so we went down this road of, okay, let's try this out. And we ended up supplying pedometers to his library and a couple others in different regions. And it really was just a test. And folks, I think, took them out for 30 days at a time. And then we asked for feedback, just a little card where they said, did it make them move more? Did it make them more aware of their exercise? And so that really, we didn't do a full-blown kind of assessment of what were the effects in terms of my public health folks might not, pre-post that kind of thing. It was more just to see, would people be willing to do this in a public library because it was a little bit out of the mainstream? And based on that response, David really took off and thought, wow, I had never thought of the public library as being a place for health promotion. And in terms of full disclosure, he is married to a physician. So all of a sudden they had this network of healthcare kind of notions and ideas and really, really took off with it. So he started working with the town and talked to them about putting in a walking trail and maybe making Farmville a model of a healthy community. And it's been many years in the making now, but he has just added more activities. And the assessment tool was something that I instigated. It was a UNC research tool, the Carolina Health Assessment Research Tool. And that was another thing where it was just kind of a pilot to see if folks would come to the library to do this. And we had 10 folks who did, and 9 folks followed up 6 months on, and then a year later. And again, we didn't do a full-blown kind of analysis in terms of pre-post test, but we did find that the folks that did the tool did attend more to their health factors. Now, whether they were folks that were likely to do this anyway because they were at that phase, came to the library just for reassurance or to move them along on that path. But anyway, round, these folks reported one gal lost 20 pounds over the course of that year. And a number of them gave feedback like, I paid much more attention to the time of day I eat, what I eat, when I eat. And so it was over a period of time that David kind of insinuated himself into the town and was just at all the meetings and at all the library meetings, brought up ways they could be doing health promotion. And then the town said, well, this is so important. And if we are going to be working with recreation and parks to build a path around our town, and the library wants to create a story walk in that, then let's give you a more official kind of title that spans beyond the library. So that was how he became the town wellness coordinator. I hope that answered your question, Mariah.
Oh yeah, that is so awesome. I mean, I just love that. I think that, I haven't really considered, we have a story walk set up, and it's definitely encouraging people to go to the fairgrounds where we have it set up. And I'm just thinking of all the possibilities that are available there. So thank you so much for this awesome presentation.
Sure. Well, and I think too that he also started a walking group, and we did give out Fitbits, and we did an essay contest, and whoever had the best essay, and David judged them, got a free Fitbit. So I think we gave out 5 Fitbits. And so you could, there's all kinds of ways to promote this, and you could have a local business donate the Fitbits, or a friends group donate the Fitbits. A lot of ways we can do this, and really like low effort, at least from my perspective, to get the ball rolling.
So this is Joy again. This is getting me thinking about some things that are already happening in Vermont libraries, but ways that we could maybe shift them if we had more information about assessment tools, because a lot of libraries are lending snowshoes. Definitely a lot of libraries have robust hiking and cooking collections, which I love how you tied that into that, those being health resources, which I hadn't really thought of in that way. So I'm wondering if you have any ideas about how a library could track data of something like the snowshoe usage in a way to share. Everybody's worried about their budgets, of course, now. I mean, they always are, but more than ever. And I'm just thinking, like, if this could be an advocacy thing where we could shift things that are already happening or will be happening again, when people can visit libraries in person, and just kind of rethink of it so it could maybe be useful in a new way. Do you have any ideas about that?
Yeah, that's a great question, Joy. I think, I wonder if when you loan out the snowshoes, you couldn't loan out like a low-cost pedometer, and then when they come back, see how many steps they took in the snowshoes, and then do like a, countywide, how many steps have public libraries in Vermont enabled in snowshoes? So you could do things that could make marketing and promotion. Also, just when folks return these things, just have to fill out a little card about their experience with it. And did this enable them to get out in the countryside because they couldn't afford snowshoes otherwise? Or I would start trying to collect the anecdotal data of how this is having a positive impact on folks. And I'm trying to think in terms of full-blown physical assessments and physical activity assessments. Let me think on that and get back to you, Joy. Like the chart assessment tool, we did just do that pilot, but I do feel like we could be collecting data from folks in terms of how have libraries got them moving a bit more.
Yeah, and I was thinking about the one thing I never thought about doing was like tracking when people check out cookbooks that are like, I know that the library I worked at, they were often like health food cookbooks, they'd be the, how to cook with root vegetables or something. And I'd be curious to see, like, to track that and see, did your diet change because you found some healthier, delicious recipes from a book you checked out from the library? And tying back into obesity and rural health as a rural health issue.
Yes, exactly. Yeah, no, this has my wheels going in terms of how do we, and I think the first thing is just to collect it from the patrons, find out, did that have a positive impact on their health? And then we think about library users versus non-library users, and can we make comparisons?
Yeah, this is great stuff. Does anyone besides me have more questions? Because I have another one. Yeah, Mariah mentions that it's feasible to do during COVID. Yeah, because there's you know, the great thing about Vermont is there's so much to do outdoors, and really in almost all seasons, maybe not mud season so much, but you know, you can still be out in your snowshoes.
Yes, yes.
And be socially distanced.
Well, and so, I did want to mention there are things happening with COVID, and maybe folks in Vermont are doing this as well, just in terms of librarians being contact tracers and libraries that are using their maker spaces to make personal protection equipment, and just libraries are really stepping up. I'm always amazed at the resilience and flexibility and adaptability of public libraries and their staff. It really is I think, last vestige of democracy we have. But we won't go down that road.
Well, so my question was on a different topic now. So part of this grant also was rural mental health and the challenges of that. We had some statistics about like the number of hospitals in Vermont and the number of therapists and how hard it is, like if you're in a rural setting, to get mental health services. They often require transportation, and you might not have transportation. So I was wondering if you had, you know, advice specifically about that. And this sort of ties into also there was something in your book about sort of like cultural sensitivity when you're dealing with like readers advisory or dealing with patrons, and being sensitive to like the background of the person you might be talking to. And so I wondered if you could talk about that a little bit as well.
Well, so gosh, other than being a human, I suppose, this isn't my area of expertise in terms of well, I suppose I do know about health literacy and cultural sensitivity around that. So I'll talk about that a little bit. But I think from my perspective, it's just very much how you treat your patrons who might not have mental health challenges. So just that compassion, that emphasizing to staff that the library is a place for the whole community. I know that I had challenges around this when I was at the Sydney Library with some of the staff members who thought we should just concentrate on the quote unquote good patrons. And they almost made the library not as welcome for the folks whom were challenging at times to have in the library. So I went the other way. I went overboard to assist those folks. So there was one gentleman who had significant mental health challenges, and the library was his place, his safe place. And we just made sure that when he came in, he had his area and he was secure and safe. And we just were very kind and compassionate to him. And when he needed help finding resources, we tailored them to him. And of course, this was a small community and we all knew the folks that were having challenges. So it was easier to attend to them. I think that we really do just need to be, especially in these times, overly kind of accommodating, because everybody is going through a global pandemic. I heard a quote from someone that said, living through history is really hard. So everybody is in a really fragile spot, even those who have the most robust kind of mental health support systems and kind of baseline. So I would just say compassion, kindness, and model that for staff. I don't know if I answered your question, Joy.
Well, that definitely is the first steps, and yeah.
And also making information available in languages folks speak that's other than English. Really drilling down and finding out what those folks need. And so, for instance, if there's in our region, we had the folks that migrant workers that came to work in the fields, and we went over to their workplaces and did English as a second language training on their lunch break. So think of ways you can reach communities that might not be having them come to the library. And think about, does your library have a security camera on the outside door? Does that create a barrier for folks that don't want a picture of themselves on a security camera? Just be thinking about from the patron's perspective, and how do we serve these folks who may not in where they've come from have a public library where things are free, where you can go in anytime. I worked with a group of Iraqi refugees in Syracuse, and they just were blown away that they could go to the public library and take books out. It took me weeks to convince them to come because they didn't have to pay. It was a very hard sell for them, but now they're active library users, and their kids probably are in high school now. So we took them there for story time. So I think just try and think out of the box and think how can you reach folks that you might not have coming to the library.
Yeah, that's a great idea. And I was thinking that your resource you shared early on, the county health ranking, that would be a good thing. There may be people in our counties that we don't realize are there, populations or.
Yes.
So that'd be a good place to do some research first. And yeah, I love that idea, that reminder to get out of the building.
Yes. Although it is, with COVID, we're all thinking, well, what does that look like?
Right. Yeah.
But it's been kind of nice to put COVID aside for a little while we're talking today.
I know, it won't be here forever.
Yeah.
Well, does anyone else have any questions, comments, or want to tell something that is going on at your library or has been going on back pre-COVID? Any fun health related, or not necessarily fun, but important health things that you might have been doing, initiatives at your library? Fun things you're circulating that keep people healthy?
This isn't something that I'm currently doing, but something that I really want to do. Oh, of course, my daughter came in now. But I was thinking, because we have the fairgrounds right there, it would be so awesome to have some sort of bike, rental. You know what Okay, I'm sorry. I'll take care of that in a second. All right. Well, maybe you're catching what I'm throwing here, but of course it's working.
Yeah.
Just like where people could rent the key, go down, unlock the bike, ride it around the fairgrounds for a while, because I know that something that stops people from coming is that they don't have bike racks, or, whatever it might be. Sorry, I have to mute. She's crazy.
No, that's okay. It's a great idea, because I think also that's a really accessible place to ride a bike too. I mean, sometimes it's hard in Vermont if you're not like a serious biker to just hit, if you don't want to go up huge hills. I'm speaking from personal experience on this. I love riding a bike, but flat places are nice, and there aren't a lot. And again, just like bikes are not, they're not inexpensive. So, and again, like I'm thinking too of the snowshoes. Like it's for some people that's an every so often thing. It's not, so you don't necessarily want to own your own, but sure is fun to do sometimes.
Yes. So I think I mentioned I teach collection development at UNC, and one of the assignments I have the students do every year is to do a pitch, to do a 5 to 8 minute pitch to a community about a new resource the library should adopt. And inevitably somebody chooses bikes. So Mariah, folks have been thinking about this, and I think that it's not too hard to do, especially if you already have a bike rack at the library, and they do a feasibility assessment and how it would improve the community. And I think there are models of public libraries out there doing it. So that's one of the great things about libraries, is we're all about sharing information and sharing ideas. So you can definitely, quote unquote, steal it from someone else.
So Susanna's written in the chat about parenting, book discussion groups around parenting. Jessica Lahi and Molly Millwood. I don't know of Molly, but that's a really interesting thing too to think about.
Yes.
Parenting in terms of health. You know, that's definitely a good parenting creates healthier children, and so it's an interesting tie-in to this.
Yes, that's lovely.
I have a collection development question. This is not specifically a health resource question, but since you're here, it's such a great opportunity to ask you questions. Could you talk a little bit about the balance between being responsive to like patron requests and your specific community, and what resources you should have versus like a library should have certain standard things, or whether or not they even should. And actually that it would be relevant to health resources specifically, because like as we talked in email about, you know, the small budget, small physical space, we're not going to have a ton of health resources in a small public library, but should you have something that is really relevant to the situation in your small town, like what's the balance between that and like everybody should know about Lyme disease, or you know, that kind of thing?
Right. Yeah, that's a great question, Joy. And we grapple with that in the class because every community is different, yet as public libraries, we're kind of subscribed to having the New York Times bestsellers available. And so then too, what happens when the New York Times bestsellers are by popular folks writing about health that might not be evidence-based? So the example that I like to use is the Jenny McCarthy's books were #1, and I kind of don't want to open up the big can of worms about vaccines and autism, but billions of dollars have been spent to show that vaccines do not cause autism. But Jenny McCarthy's book was a #1 bestseller and folks wanted it. So, and her book described her son becoming autistic after being vaccinated, which ended up not being the case in the final analysis. And the gentleman who wrote the original Vaccines Cause Autism article lost his medical license. So it's been pretty well kind of described and shown that there isn't a link. That's not saying there's other issues around vaccines or efficacy and things like that. But again, we won't go down that road. So my point is that there is it's really tough in terms of what do you buy when you have limited funds, when you have limited shelf space, and when you're trying to also fulfill patron expectations. So lending certainly helps with that. Interlibrary loan certainly helps with that. When I was looking at different models of health information, there was a consumer health information center started in the Glens Falls Library and here in New York. And they worked with a hospital librarian on coordinated collection development. So I think that we could be doing more models of sharing, but targeted sharing. So say you have 2 counties that are adjacent and one has a high diabetes prevalence and one has a high hypertension prevalence. Well, then maybe the basic books about diabetes, the one community collects, the other one collects on hypertension, and then you share. You become like that library that focuses on that subject, and then you share. And that's a way, I think, to extend resources. I think that patron demand also should be a big part. If a lot of folks are coming in and asking about whatever it is, tick-borne diseases, or, you know, does it make sense to buy a book on that? Maybe not. Maybe it makes sense to go to cdc.gov and medlineplus.gov. So I think part of it is being on the ground in the community and seeing how people expect the delivery of the information. In my experience in Sydney, the more senior folks wanted a print book, but very often we wouldn't buy that book, we would borrow it from another library if it was a really expensive kind of health reference tool. I'm not sure if I've answered, Joy.
No, I think that's really important, and that we have toyed with that, like in one of the libraries where I worked, the idea of like all the Vermont libraries are separate, like we don't have systems and branches.
Okay.
But
yeah.
So we just thought regionally, we never quite got to this, but the idea being that like sort of like what you mentioned, where like one library could specialize in something, and the one that was only 5 miles down the road that in another state would be part of the same system,
Yes.
could specialize in something else, and then we could let patrons go back and forth, because
Yes.
you don't, everybody
Yes.
doesn't need to have everything.
Yes.
And speaking of health resources being expensive, I'm going to do a pitch for the, we did buy book sets as part of this grant, and anybody who attends 3 of the workshops related to the grant, their library can be entered to be one of the 20 libraries that gets the book set. So
Beautiful.
keep that in mind. Those of you who are here, and there's still a few more that you could pick from. Does anyone else have questions, comments? I'm going to put the evaluation link in the chat one more time. It would be really helpful if you did this for us.
I should say too, in terms of back to the rural mental health, I have to apologize. I was a bit distracted. The dog was barking, and I was trying to figure out my husband came back from a run with her, and I was trying to figure out how to get her to stop barking and to address your question. So I do want to revisit a bit and just say, also work with your social service agencies. A lot of libraries are bringing social workers in as team members in their libraries. So I would rely upon your local support system and experts to help you with those. I know at the Sydney Library, we did regularly refer people to the social services agencies in our town. So again, collaboration, we are not in this alone.
Yes, that's a great reminder. All right, well, I think we've probably come to about the end. If anybody has other thoughts, they can certainly share them with me later. And I'm excited to share these slides with a larger audience too. Mary Grace, this was so helpful. And a reminder again about the book packets. Her book is in the book packets. So if you want to put your name in for that. It's an excellent book. I learned a lot from it, and it's been so nice to be able to ask you questions in real time. So thank you again for doing this. Thank you all for attending, and the rest of our workshops that related to this grant are all on our website. We have a mindfulness one with Darren Larson next Thursday, and one about cannabis literacy the following Thursday. So just look at the website, and as usual, all of our CE stuff is on there. So thank you again, Mary Grace, and thank you everyone for attending.
Oh, thank you, Joy. What an enjoyable way to spend a Thursday morning in the summer. And next summer, maybe I'll pop over to Vermont.
Oh, absolutely. We would love to welcome you in person, in real life, and hear you speak. Yes.
And everyone, take good care.
You too. Thank you.
Thank you.